Welcome back, viewers, to the Now Morning Show. And today is World Water Day. So as we continue along that theme, I have a guest in studio with me, Dr. Wynelli Pierre. She is a physiotherapist with a specialty in aqua therapy. And we're going to be talking about the benefits of water therapy and rehabilitation. So welcome, Dr. Pierre.
Thank you for having me.
So Dr. Pierre, persons know about aqua aerobics, but
Yes.
persons don't tend to know what aqua therapy is.
Correct.
Could you just give us a little synopsis of what it is and what is the difference?
So the difference would be that aqua aerobics is more based on focus on fitness compared to that of aquatic therapy, which is the use of water to be able to carry out physical rehabilitation. Most times relaxation as well.
Okay. And who are the persons that would need aqua therapy? Is it for everyone, or is it for persons with specific limitations or injuries or so?
So yes, most times when you're dealing with physical rehabilitation, that is a very large group, and it can be anyone dealing with a disability, a disorder, or an injury. Some examples: Parkinson's, strokes, persons who've had a fracture to their leg or hip, knee replacements, hip replacements. Those are just to cover a small group of the wide vast of persons.
Okay, what are some of the activities that persons would usually use in the, do you perform therapy in a pool or any kind of body of water? What is that like?
So yes, usually we utilize the pool as the aspect because it's the most contained, but it's the most comfortable environment for them. So most persons will complete the aquatic therapy within a pool setting.
Okay, and what does that look like? What does that therapy look like?
So it can vary, but it depends on the person's injury and the area of the injury. So you can have, if a person has a shoulder or neck injury, the person can use resistance. You can also have it in relation to their leg, even if it's their spine. If it's their spine, we can perform in deeper water with noodles and then transition them to more shallow water where they're standing, to help them assist with accustomed to gravity to decrease their pain level as well.
Okay, so persons utilizing aqua therapy, they are in the pool.
Yes.
And you use aqua therapy mainly because of the resistance in the water. So does that help them on land? How does that translate to
Yes, that's always a big query that even our patients have. How does it help? So what it does is an easier progressive way to be able to get them more accustomed to performing functions on land. Most persons that we transition from water to land are those that are very weak or in a lot of pain, so they can't tolerate activities with gravity. So allowing them to be within water allows for them to assist with the buoyancy of the water. That takes the load off of their body with gravity and allows the water to support their body more so they can carry out functions that are harder to perform on land or even more painful. So in doing so, the resistance of the water, the viscosity of the water strengthens them enough to be able to support them more when they're now performing their activities better on land.
Okay. I have a brother, he was in a car accident a few years ago, and aqua therapy was one of the therapies that were recommended for him.
Nice.
Because he had a brain injury and a spinal injury. So I know that some doctors don't recommend aqua therapy
Yes.
because it's not traditional medicine.
That's right.
Why do you think that is a good option?
So I would say doctors now, that's one thing, they are now being more open to the idea and are now realizing the benefits, but it definitely is a good option. As you said, as you saw for yourself, it can be a vast community of persons going through rehabilitation. And for him, it would assist him in decreasing his risk of fall because he's in a now safer environment where he can function to assist in rehabilitation with the walking aspect. He's also going to feel more supported in the water. You can carry out more coordinated activities for him in an environment that to him feels safe. The weakness in his body is also being supported so he can strengthen his body faster than if he was on land.
Okay. What are some of the limitations associated with aqua therapy?
Well, I think one of the main limitations, it's really persons who are fearful of water. I think the other limitation would be the specific pool that the person has. The depth of the pool makes a difference. The access to the pool is also what makes the difference to persons. One of the challenging limitations, I think, for us, I don't think anyone has a warm-based pool that is easily accessible. And that sometimes the temperature makes a whole difference in how the person feels when they're in the water. So the temperature of the water, the accessibility to the pool, and the depth of the pool are some limitations you can find.
Now, during the COVID pandemic, COVID-19
Yes.
pandemic, you know, pools were closed,
That's
bodies
correct.
of waters were closed.
Yes.
So how did that impact persons who would have really needed this type of therapy?
But as it's a niche and a subset of physical therapy in itself, thankfully you have been able to transition them still with providing care for them through the standard-based physical therapy. There are ways to manage their pain through physical therapy. It's an easier way, a more comfortable environment for them. So most patients, we did try our best to be able to transition them through that period until pools were open again.
Oh, that's fantastic. And how has business been since?
Thankfully, it has been doing well. I think most patients are grateful that pools are back up and running, and we have been following as much COVID protocols to ensure their safety as well as ours as we're now back up.
Okay, so we have an example. We have a video of some patients utilizing aqua therapy. Of one patient
Yes.
using aqua therapy. So we're going to play the video,
Sure.
and maybe you can describe exactly what is happening here.
Not a problem. So this is actually an activity for strengthening, especially the triceps, so the muscles behind the arm. They're assisting them, but it's also core-based exercise because once there's resistance through the water, it's able to assist in their trunk stability because their balance is thrown off once you're in a water anti-gravity environment. So the activities that are being carried out are mostly of the upper body within this video. So we did the noodle, and that was for more trunk stability, but also within the shoulder aspect. And I'm sure they're going to do more activities now within the upper body as well.
Yeah, he's squatting a bit.
Correct.
So all of that is for that.
So the squat helps with the stability as well. The depth of the water changes the level of resistance.
Okay.
And it is height. So this one shows that you can facilitate push-ups. Most persons, their strength can't maintain their body weight, but you can facilitate it even better in water.
Okay. Can anyone perform aqua therapy in terms of the person
The individual
managing the
themselves.
patient?
Yes. So there are some contraindications. Patients must have controlled blood pressure. They must have issues if they have urinary incontinence or any type of incontinence. That is also an issue. No open wounds. All those are different aspects that obviously are safety for them, but also for other patients who are entering into the water environment.
Great. Well, thank you very much, Dr. Pierre.
And thank you for having
This
me.
has been extremely informative to me and especially to our viewers.
Yes.
So thank you for joining us here on the Now Morning Show. And viewers, we'll be back with another interview.